Great, thank you very much. There's a lot of support in the room, I think, for a single payer system, and there's a lot of discussion, I think, that I'm hearing about what's the role of insurance companies in healthcare reform. And so I'd like to offer, I see the President and CEO of Blue Cross Blue Shield here, who's Dan Lepp, and I'd love to hear your perspective on what the role is between the private and the public sector in a healthcare reform environment. Your
Thanks, Governor Doyle. I think the number one thing that the insurance industry, and I come out of state government, out of Michigan state government a while ago anyways, is we have an obligation to embrace this change. I think if you look back 15 years ago, the industry didn't do that. And frankly, shame on us for not sitting at the table. And I think, at least in representing the Blues Plays, we represent about 100 million lives that are covered across the nation. We are committed to being at the table and embracing change. And that means, from our point of view, we still believe in the employer-based system. And we believe that it needs to be enhanced. There needs to be public-private partnerships. The idea of tax incentives for small businesses. Our idea of transparency in our system. Michigan's kind of an interesting place, because between the biggest insurer, the HMO, and the local HMOs in the state, and the hospitals, we are entirely nonprofit here in Michigan, which is fairly unique around the country. And I think there are plenty of things that we need to do, but most of all, we need to say, and we need to mean that we're willing to sit at the table and change. The way of just saying no doesn't work. It's not going to work. I hear it loud and clear, and I hear it loud and clear every day. And we're committed to that change. And that's going to mean things that the insurance industry is going to have to do significantly different. But we are in an industry that, when we have heard that healthcare has created all the jobs in the last 5 or 6 years. We've got 9,000 employees, 4,500 UAW members working right here in Michigan for Blue Cross Blue Shield in Michigan. And we're committed to the change. That includes the employer-based system, individual and small group, where it's got to be much fairer. We support a guaranteed issue with a individual mandate, because we believe and we agree that everybody has a right to health care. So I think there is an ability with private insurers, and certainly we're committed to doing that, of sitting at the table and fundamentally changing the way we collectively do business, and I think things can change.
Well, I think change is important, right, from the insurance industry side of things too, and I appreciate your perspective on it. I think a lot of people think when they hear employer-based system, they all think, as somebody over here said, well, what if I don't have a job? Obviously, an employer-based system, you got to make sure that everybody's covered, and I think that's what you were saying. It's not just employer-based. If you don't have a job, you still have to be covered, because that's what quality health care for all, which I think is what we're all about here, is all about. The question is how to get from here to there.